Absolutely.
Dr. Kushagra Jain from
So
Indore.
Indore,
Indore. He
so
is.
he is he just finished his fellowship and he opened a big hospital with a bang. Okay, with bang, having everything in Indore. He got two of his friends to join him, who are different specialities. He does retina, one does cornea, and one does glaucoma. And they're expanding. They from day one, I think you got a LASIK, you got topography, you got everything it is. So he is going to, he's the right way when you're finding your niche. He's trying to build a corporate practice. He already has other hospitals, but so he's going to speak about finding your niche in a corporate-driven world. Over to you, Kushagra.
Good morning, everybody. So, first of all, sir has actually given a very exhaustive talk. So, everything is actually very well covered. I'm just going to give my two bits on this from a young ophthalmologist's perspective. So, the topic is finding your niche in a corporate driven world. I'm Dr. Kushagra Jain. I'm director and vitreoretinal surgeon at SRJ Netralay in Indore. So there can be two ways to go about this. One is finding your niche as an ophthalmologist, as a vitreoretinal surgeon in that corporate world in the city that you live in. And the second is as a setup, how you develop a niche for your setup amongst the different corporate setups, right? So I'm going to go with the latter and talk more about the setup and how you deal with the other corporates and how you go about the practice. So just a bit of background of me so that I can take the talk forward from there. I am from Indore, which is a tier 2 city. So tier 2 cities have their own advantages and disadvantages. The advantages, when I joined my fellowship, I was already in the process of thinking what I want to do, how I want to go about my practice, whether I want to join more corporates or start off my own hospital. So the good thing about tier 2 cities at that time was that there were no major corporates, right? There was maybe one or two. In my case, only one, and more or less they were more of private setups, and all of them, there were very few setups which are very comprehensive. So the private setups were also either more focusing on anterior segments, or there were a few who were focusing on the posterior segments, but there was no comprehensive setup other than one or two hospitals. So that is one good advantage that I had with Indore, and that was my goal. That is what exactly I wanted to do. And so I'm a first generation ophthalmologist, so I did not have any practice to build up that upon, so I had to start from scratch. So that can be tough to do in being a first generation ophthalmologist, and at the same time it was a good business opportunity, but because there was no major centers like that. But now when then I finished my fellowship and I came back to Indore, there was like this sudden flood of corporates, which is true for all tier 2 cities, right? Everything just all of them just open up together, the usual suspects. So what do you do then? You analyze and you reanalyze and you think what are the challenges that you can face because of these corporates. Not to say anything against the corporates, but these are the usual challenges that private practitioners face when they compete with these corporates. So the first thing is the brand, right? all of all the general public knows about these brands. There's a lot of marketing happening, so a brand does attract patients from the very first go, from the first day. So that is the biggest challenge that private practitioners face from the corporates. The second is, we know all the deep pockets and all the enormous marketing budget that they have. So the corporates have, a lot of them have full page newspaper ads monthly, which cost nowhere less than 3 to 5 lakhs per month, which initial private practitioners can't even think of spending in their initial years of practice. Then there are hoardings all over the place, all over the city, which you really can't do, again, which cost about 2 to 4 lakhs, 5 lakhs per month easily. A lot of them give free OPDs. That is something that we can do, but that is one more challenge. The other thing is high paying capacity to professionals. So when you're trying to build up your own private practice and you are the sole practitioner, then it's okay. But if you want to hire other professionals, other subspecialty surgeons, then you have to compete with these professionals to pay them similarly. And one more very specific thing that I now face with the corporates is that the medical claim approvals and the rate lists that we get from the medical claim companies are very different from these corporates. So all the rate list approvals that they get are very centralized, and we at private practitioners deal with the local bodies, and the rate lists are nowhere comparable. So that is one thing that I don't think there's a solution to this, but this is one of the challenges that I face now. So when you start off, like when I started off, at least, I really feel that competition doesn't matter. It doesn't matter what corporates are there, how many practitioners are there in your city, how many corporates are there, how many retinal surgeons, or for me, are there in the city, because you are nowhere. You are like at the bottom of the food chain. So competition doesn't matter. You have to actually make yourself worthy of competition first. You have to reach a certain level, and then you can maybe try to compete with the others, right? So first thing, get your bases covered, make a place for yourself. The first thing is to, so I've jotted down to 4 major points. If you have these 4 working on the first day for you, then you are on the right track, right? So first thing, what is your vision, goal, aim, whatever you want to call it? Know your niche before you start to find it. So you need to decide what kind of a practice you want to build. You want to open a clinic, or you want to, as sir said, you want to join and partner with other neutral diagnostic centers and neutral surgical centers, or you want to develop a comprehensive setup with other surgeons, maybe in partnership, maybe you want to hire them, maybe you want to develop an institute, maybe you want to, if you want, you can, start off with different branches, go into a chain model, you can get funding. There are so many ways to go about it. You need to actually make up your mind what you exactly want to do, and that is actually the most important thing. A lot of people start off their practice, they're very confused which way they want to go. I feel this is very, sorry, I don't think my 8 minutes are over, but okay. So, yeah. So this is, I think, one thing which is very unclear with a lot of people, and this is, I think, the most important thing where people need clarity of what they want to do, because uh, things can go in very, very different directions. You need to be very goal oriented and very focused. The second thing is you need to build up a team. So in my, what I did was I made a comprehensive setup that was always the best thing that I wanted to do. So I obviously wanted the best surgical expertise. Without a surgical expertise, without good surgeons, you can't do anything. So I wanted to cover, I practice posterior segment. I had good, I was very, very lucky, and I have actually OC to contribute for that. So I actually, that time they had opened a hiring portal on which I had posted a vacancy for my hospital for all the subspecialties. And through there, I had Dr. Nikunj and Dr. Shivani, who responded to that portal of OC and then contacted me. Of course, they were colleagues of mine previously, but that is how they came into touch with me through the OC portal. So thank you for that. The third thing is the equipment. As sir said, good equipment is very, very important for delivering good results. So if my take on this is that if you don't have a source of capital, then yes, go with cheaper equipments. There are a lot of good options, and eventually when you develop your practice and you develop some capital in the next 3 to 5 years, you are going to possibly upgrade. That is the goal for everybody. But I feel if you do have a source of capital, then do invest in all the better equipments, because if you invest them, you are going to get better results. The equipments for better equipments for young surgeons are far, far more, helpful for a young surgeon than they are for an older surgeon who is more experienced, because they do help you in your practice and delivering your results. And then, if you have your good equipments from day one, you can actually plan them to keep them for the next 10, 15 years even, and you don't have to invest in them later. So that is my take. If you have the source of capital, go ahead and take that risk, because you have to take that risk on yourself. If you don't have the capital, you have a lot of options. The fourth thing is to make protocols. There are protocols for everything. There are protocols for documentation, for registration, for patient flow management. There are protocols for the consent forms, right? There are protocols for your IPD filing, your NABH protocols. These protocols help you to maintain your quality. So one day I just went to see an emergency patient on a Sunday, and we are very lazy on a Sunday. You don't want to switch on your computer, you don't know how to switch on the AMR, you don't know how to register your patient. So I just brought out a prescription, tried scribbling on it, which I never do. I use an EMR. So on that day, that was an acute angle closure attack patient. I forgot to mention the IOP of that patient, right? I mentioned all the treatment and everything, but I forgot to mention the IOP. So these are the sort of basic mistakes that you do when you don't follow your protocols. It's very important to follow protocols to save you from yourself. So these are just 7-8 points apart from these 4 major things. So staff is very, very, very important. So when you are young, for me, like I was an amateur, I started off just immediately after my fellowship, opened a hospital. If when you are not experienced, you can actually hire experienced staff. Like you can bring experience from outside to help you. And there are very, very minor things that my staff had, you know, taught me, and they came from all different corporates and they've been working in this field for the last 10 years. And sometimes you feel कि यार मैं boss हूँ कि वो क्या मुझे सिखा रहे हैं, but you know, you are the amateur, you don't know how things work in an ophthalmological hospital. You have to be humble enough to, you know, learn from them. You have to be humble enough to accept that they are more experienced, and you have to take that in. The second thing is, of course, when you're beginning, you have to multitask your staff and you have to multitask yourself. But at the same time, I feel we should not be too stingy about this. Another one extra hand, 2 extra hands really go on a long way to make those small changes in your hospital, do those small jobs which just, you know, increase the quality of your work. Welcoming faces change the vibe. I really feel this is one thing that I really feel that, you know, we can, as private practitioners, offer more than corporate hospitals, because this how the staff behaves, how welcoming the staff is, how you are welcoming, how much you're counseling the patients, how well you're talking to the patients, how the first contact, I feel the registration person who's registering your patient, how that patient is greeting the patient, that is the most important thing. And that is something that you can really implement in a private practice more better way than a corporate hospitals. I really feel that. Time is in your hand when you're starting your practice, right? So when you're starting your practice, you have less patients, you have more time. So time is one thing that is cheap, that is freely available when you're starting off, and that is really an advantage over the other corporate hospitals. Reduce your waiting time, and give more chair time. These are the only 2 most important things that I feel a patient wants from any hospital. And see, when a patient is coming to you as as a young professional, he's not he's okay with you not being experienced. But if you save his time, if you take less time to see him, if you give him more chair time, if you listen to him, if you know understand his problem, that is something that you can give more, and he can value that more than, you know, going to a more experienced surgeon. So for a young professional, giving more time to your patients and reducing his overall OPD time can be very, very important, can be a big bonus, which is very cheap for you to do over the other corporates and more experienced surgeons, right? Again, जो दिखता है वो बिकता है, as sir said. You have to, as young professionals, when you're competing with all the corporates, you have to bring out, you have to flaunt your degrees, your designations, your awards, your fellowships, your everything, your research papers, and whatever marketing you can do, right? So
Sorry, to the next. Yeah, sir. We got the hall 40 minutes late. We got around 11 o'clock. So 11:10 actually we got the hall. So we'll try to wind up by 12:15. But thank you.
right, so getting back to it, spend on your board and your AMR. I feel this is very, very important. You need to be very, very visible when you're competing with these corporates. So spend on your branding and your board. It should be absolutely visible in bold, big letters. Spend on your name. Your name should be visible. The hospital's name should be visible. Spend on an EMR, again, that manages your quality. Uh, yeah, charges. Start with low charges. You know, initially, don't sell yourself too high. Don't overestimate yourself. This is very, very important. You are actually at the bottom of the food chain, so you have to accept the fact. You have to start with low charges. This is very, very important for hospitals to be able to, you know, find out, you know, make a space for themselves in the market. Empanelments, these bring patients to you, and without these, I've myself significantly realized, before I had any medical claim approvals, uh, and after, the overall number of surgical procedures have more than doubled, maybe even tripled. And now if I say, out of all my number of surgeries, I think about 75% of all surgeries are empanelments or all medical procedures. The rest are Ayushman and other things. So this is a list of, I think everybody should do, whether you are you're running a corporate hospital or you're doing a private setup. Uh, Even if you don't have your own hospitals, if you're running private clinics and you have affiliations to diagnostic and neutral surgical centers, make affiliations with surgical centers who have these approvals so that you can take care of these empanelments. You don't have to have your own hospitals to take patients of all these institutions. So this is very, very, very important. This will immediately build up your practice. And the last thing is, when you're running a private practice, you can actually the patient knows who's in charge. The patient knows the person sitting inside that room can be approached with any sort of any basic issue, and that personal touch can be given in a private setup, which usually maybe lacks in few of the corporates. So that is where you can build your trust as a private practitioner and compete with the corporates. Yeah. And again, ethics are very important. It can be very, very easy to just diverge from this path, because we all have VMIs, we all have loans and everything, we all have equipments to take care of. But ethics is knowing a difference between what you have a right to do and what is right to do, and eventually it does show off in your practice. So that is extremely important. Thank you.
Very nicely covered, Kushagra.
Thank you, sir.
Fantastic. At your age, you have done fantastic work.